Uh, Good evening. Good evening, everyone. This side, Dr.G, and welcome to the session on General Anatomy Part 1. So I will be teaching the entire anatomy live on YouTube. So I will be starting from the basics. Okay, so there are 7 lectures of General Anatomy which I have planned. So before that, I just want to know everyone, like the audio and visuals are clear. Please let me know, guys, if the audio and visuals are clear. Just give me a thumbs up in the chat box. See, this is an interactive session, so everyone has to participate over here. Yes, Badal Vankar, yes, it is helpful for BMS students also. MBBS Almaty, okay. Jai Shri Ram. Amreen, hello. Raviraj, good evening. Pixel ready, yes, okay, perfect, guys. Yes, Vankar, it is very much helpful for BMS students as well. Yes, Christian Sahu, yes. Amreen, good. Osama Sheikh, good evening. So it has been so long now, guys, we haven't interacted. So yeah, apparently I'm like here reading out your comments, and I hope everything is clear as such. So yes, what you guys have to do, beta, you have to take out your notebooks, right? You have to prepare your own notebooks. Okay, topic wise, like general anatomy, I will be discussing with you. You have to write the notes along with me. Okay. So yes, Sandeep Shah, Jai Shri Ram. जीत yes BHMS के लिए भी है. Please try to go with the flow. Yes, Sri Ram Tripathi, you can also attend the session. You will understand the core basics of anatomy today, right? I have 7 lectures of general anatomy which I will be teaching you on a daily basis starting from today. And yes, lecture duration pata nahi, I'll go with the flow, whatever you guys will try to interact with me. And yeah. Hmm. Sure. Vedant Patil, Rohi, good evening. Saloni, good evening, beta. Sure. Let's start with the session and without wasting much more time. So yes, the very first part that we are going to discuss over here today. Yes, please comment in the chat box also so that we are no in yeah, we are in touch, right? So yes, Sandeep, I will cover. Please believe me. Yes, Sabine Raj Singh, it will be on a daily basis. Medico Lover Raza, good evening. It will be on a daily basis, guys. I'm promising you, if you participate in the same way that you're participating today, I will cover everything on the YouTube itself. The topic is General Anatomy Part 1. So, firstly, we will understand the concept of anatomy, guys. Hamza will understand the concept of anatomy today. Now, the very first thing, guys, that I want to know, or I want to know from you guys, there is a term that is called as Tommy over here. In class 12th, guys, 11th, 12th, no, you have heard about 2 basic terms, right? You heard about, yes, you heard about vasectomy and you heard about tubectomy. Okay, yes, good evening, Sanjay. Yes, so you heard about vasectomy, you heard about tubectomy. What does Tommy mean, guys, over here? Where the vast difference or where the fallopian tube is dash is dash. Can anyone comment in the chat box? The vast difference in the males or the fallopian tube in the females, it is okay. So anyone? Hmm. Yes. Yes, Ruhi, very good beta. It is cut. It is cut. The simple word, Christians are very good beta. It is cut. It is cut. Anatomy basically means Tommy. The word Tommy basically means cut. The word Tommy means cut, right? Vasectomy, tubectomy. Hamza Ali watching from Pakistan. Yes, thank you. Yes, cut, remove. Yes. Apart from that, the word Anna in Latin means to see, to see, to see. So, the word anatomy. Yes, the word anatomy, it is basically divided into two parts, Anna and Tommy. The word anatomy, it is divided into two parts, that is Anna and Tommy, right? Anna means to see and Tommy means to cut. Yes, Niku Chauhan, very good. Sabine Raj Singh, very good. Now, guys, you already know, if I want to simplify this definition, it simply means cut and observe. Cut and observe. You are cutting the different parts of the human body and you are observing whether it is the different anatomical organs of the human body, okay, or the simple muscles, bones, arteries, veins, everything. So the cut and observe part, it is done on living beings or dead bodies, guys. Now, Usman, thank you. Yes, the cut, it is basically done on living beings or the dead bodies. I'm good, Usman. How are you? Yes. Now you guys are going to tell me the cut is done on, yeah. Hmm. Obviously, it is a dead body, right? Hmm. Yes, it is a dead body. You will not cut a live human being, right? Yes. Obviously, it is a dead body. Krishan Ruhi, very good. Yes, it is a dead body, guys, right? Dead body. Now, cutting and observation, it is basically done on a dead body to study the different anatomical parts. Now, guys, this dead body in anatomy, it is given a special name that is called as the cadaver. Yes, very good. Amreen, Osama, Mehek, Vicky, Anoid, Atom, Nai, Saloni, very good. It is done on cadaver. Very, very important, right? So the cutting and observation part, it is done on a dead body, and that dead body, it is something called as the cadaver. Yes, Mansoori Imtiaz, very good, right? Yes. Now, apart from that, guys, you should also remember one more definition. It is also called as the dissection of human body. It is also called as the dissection of the human body. Okay. Dissection simply means that we are cutting the different parts and we are studying that different parts separately, right? So yes, Niku, very good. Yes, yes, yes. Dissection of the human body. Now, apart from that, guys, one more definition that I want to discuss with you guys, that anatomy, it is the science that deals with the structure. Yes, yes, being very good. That deals with the structure of the human body. Okay, it deals with the structure of the human body. But the definition is not limited to that, this particular stuff only. It deals with the structure of the human body. And remember, guys, anatomy is something that forms the basis, that forms the, just a moment. Yeah, just a moment. Yes. And it forms the basis of understanding function. It forms the basis of understanding function. Now, let me simplify this particular term to you guys. You already know in anatomy we are studying the different organs, different parts of the body, different bones, different muscles, different arteries. Now, guys, what role it has, like in medicine, guys, right? In MBBS, why we are studying anatomy, guys? Now, if you don't know the name of the bone, the very first thing, if you don't know which artery and vein no is dealing that which particular region of the body, you won't be able to study any disease, guys. For example, if you don't know, okay, the very common thing that you all guys know, from shoulder joint, okay, to this elbow joint, right? A bone is present in the arm region. Can anyone tell me the name of this bone? Okay. Now, now the thing is, from the shoulder region to the elbow region, a bone is present in this arm region. Can anyone guess the name of that particular bone over here? Yes. Sure. I just want everyone to you to answer this. Yes. Anyone who would like to tell me? Hmm. Yes, Osama Sheikh, very good. It is the humerus bone. What about rest, guys? Yeah, there is a bone that is present in the arm region. Gaurav Saini, very good. It is the humerus bone. It is the humerus bone. Mansoori Imtiaz, Satish, Osama Mehek. We will discuss all the entire 206 bones in detail. As of now, just remember it is the Raviraj, Ajay, Ruhi, Annoyed Atom, Saloni, very good. Vicky Chaudhary, very good. It is the humerus bone, guys. Everyone knows that. Now, guys, if you don't know the name of the bone and you're watching the X-ray, the best acting that do while when you are in first year and you start watching X-ray of your relatives, मतलब उसके आगे तो ऑस्कर अवार्ड ही भी फेल है. तुम जो एक्सरे देख के जो कमेंट्स देते हो, आई मीन दैट तो आर सो लेजिबल कि हाँ मिकू अतुल ठीक है तो that is something. आप रेडियोलॉजी भी तभी पढ़ सकते हो when you know the basic bones, right? If you don't know, you won't be able to study orthopedics. That is the study related to the different disorders of the bones, right? You won't be able to study orthopedics. You won't be able to study the radiology, right? You won't be, yes, you won't be able to study the radiology. Now, if you don't know about which arteries are supplying to the stomach, to the intestine, you won't be able to study all the surgical disorders over there. So even surgery also requires the basic anatomy, the surgical anatomy. If you don't know, you won't be able to understand the disorders that are there in the medicine part, right? So yes, Izhar Khan, I'm fine. Yes. Okay. Anyways, so that is something that you guys have to focus on. Key without anatomy, you won't be able to study any of the subjects. So it is actually dealing with something that is called as the function. It forms the basis, no, to understand different functions of the body as well. Physiology, okay, all the subjects, pathology, some everything just revolves around this anatomy. Now, if anatomy is not up to the mark, then yes, you will have severe problems. So, anyways, we are starting with the basics only. So that is a little bit about the definition, you can say, or the basic about the anatomy. Now, the anatomy is basically divided into two parts. As of you guys should know, it is divided into two parts, guys. Yes, the anatomy, it is divided into two parts. The very first one, it is called as the regional anatomy. The regional anatomy. And the other one, it is called as the systemic anatomy. Zora, good evening. Yes, good evening, beta. Systemic anatomy. Now, there are two types of anatomy, and I'm presuming that most of the students over here are from the foreign or the internationally trained medical graduates of India. So, yes. So over there also the anatomy, no, in foreign universities, no, they teach anatomy like first they teach the regional anatomy, then they teach the systemic anatomy, or vice versa. Like I mean, not vice versa. Like it's just a combination, guys. Now, what is the basic difference between the regional and the systemic one? Yes, Vicky Gaurav, Mansoori Imtiaz. Yes. Now, regional anatomy, you have to understood. Yes, the entire okay, or yes, just write like this that yes, the is divided into entire body. It is divided into parts, and then each part is studied independently. Each part it is studied independently. हमारी जो पूरी बॉडी है उसको हम लोग डिफरेंट पार्ट्स में डिवाइड करते हैं, डिफरेंट रीजन्स में डिवाइड करते हैं, और एक रीजन को, अलग अलग रीजन को हम लोग अलग अलग सेपरेटली स्टडी करते हैं. So our entire body, it is divided into different parts, and each part it is studied independently. Now, Saloni, yes, you are right. Divya, okay, perfect, beta. Now, guys, you guys are going to answer. Now, let us just by mark all the regions of the different parts of the body. Or we are going to mark it over here. Now, this is the same picture over here, guys. Yes. Now, guys, you are going to tell me. You are going to tell me, guys, this region, it is called as what? This region, it is called as what? Chal. Let's start from the basics, and you guys are now going to comment over here. This region, it is called as what? Chal. Anil, very good. Very good. Yes. Chal. This region, meanwhile, you are also going to tell me what is this region called as? Chal. Very good, Niku Chauhan. It is the head region. Gaurav Seni, very good. It is the head. It is the head. It is the head region. Now, when I say head, very good. Annoyed Atom, very good. Yes, Megha, Vicky, Saloni, Raviraj, Anil, very good, beta. It is the head region. Now, when I say head region, guys, when I say head region, you guys already know I am talking about two major things over here. Yes, future medico, Mansoori Imtiaz, Vicky, very good. The cephalic region. Aha, theek hai, Vicky. Okay. Annoyed Atom, Gaurav, Seni, Saloni, very good. Now, when I say head region, guys, I am बेसिकली हाँ सलोनी नेक्स्ट वाला भी ठीक है, तो गौरव यस नेक वाला भी ठीक है. यस. नाउ गाइस जस्ट लिसन ओवर हियर. व्हेन आई से हेड गाइस, I am talking about two major things over here. I'm talking about the face, okay, and along with the face I am talking about the skull. I'm talking about the skull bones, right? I'm talking about the skull bones over here, right? All the skull bones, right? All the facial bones, the maxilla, the mandible, okay? All the skull bones, the parietal, frontal, occipital, everything I'm talking about that. So this region, it is called as the head region. Now below the head region, yes, everyone is right. It is the neck region. Yes, Anil Semi, very good. It is the neck region. It is the neck region. Neck region. Neck region. Below the head we have the neck region. Now guys, you guys are going to tell me now below the neck. Okay, let me just try to mark this. Okay, this region, it is called as which region, guys? Yes, you guys are going to tell me this region, it is called as हाँ वो ठीक है. चल, I'm waiting for you people to answer this. Yes, Gaurav, very good. Annoyed Atom, Divine Soul, Mohammed Bilal, Dr. A.K. Singh, Vicky, Niku, and yes, guys. Christian, very good, guys. Future Medico, very good. Mehek, Sandeep, Positive Heart, Sulani, yes. Ruhi, Raviraj, Manish, no, you guys are interacting. So, yes. That is the thoracic region. That is the thoracic region, or commonly called as the thorax, right? The thorax. Now, in the thorax, can you guys tell me the two important organs that are present in the thorax region? The two important organs. Just I'm testing your basics, guys. Sambhav Raizada, very good. The two basic organs that are present in the thorax region. Mansoori Imtiaz, very good, guys, very good. Now, I just want to know the two basic organs present in the thoracic region. The two important organs of the body. हाँ, वेदांत अभी उस पे आते. विल कम टू द अपर लिम्ब वाला पार्ट आल्सो. Yes, Nike, very good. It is the lungs and the heart, guys. Very good. Mithun, very good. It is the lungs and the heart. Osama Sheikh, yes. Gaurav Saloni, very good. Niku, Imamul Haq. ठीक है. Christian, KK, Anil Ghosh, Mehak, very good, guys. Ruhi, very good. So the thorax basically comprises of, we study the two major organs over here. That is our lovely heart, okay, and the lungs. and the lungs, right? Now, below the thorax, you guys already know this dome-shaped structure. Yes, this dome-shaped structure that I have drawn. Can anyone name it as? What is this which is separating the thorax and this structure? It is called as the abdomen. Okay, this structure I'm telling you that is the abdomen, but which structure it is separating the thorax and the abdomen? Can anyone tell me? Yes, इम्तियाज ठीक है, अमरीन ठीक है, रविराज ठीक है. Abdomen. This dome-shaped structure. Yes, Saloni, very good. Hitesh, very good. Ruhi, Osama, very good. That is called as the diaphragm. That is called as the diaphragm. That is called as the diaphragm. Yes, Sambhav Raizada, Raviraj, KK, Future Medico, very good. Very good, guys. Very good. So, yes, that is called as the diaphragm. Now, guys, at the sides over here, guys, this particular part, this is called as the upper limb. This is called as the upper limb. This is called as the upper limb, right? This is called as the Amreen, Anil, very good. Zudra, Sandeep, yeah, Bilal, very good. That is called as the upper limb, guys. That is called as the upper limb. That is called as the upper limb. Now, now, guys, you guys are going to tell me now below the abdomen, we have a region. We have a region over here, okay? That is called as the pelvic region, guys. So I'm just, yeah, that is called as the pelvic region. We will study the pelvic bones also, right? We will study the pelvic bones also and everything. So as of now, just remember there is a region below the abdomen that is called as the pelvic region. That is called as the pelvic region or the pelvis part, right? Now, beyond that, guys, you will see another part over here, and that is something which is called as the lower limb. The lower limb. I will teach you the different regions of the upper limb and the lower limb. But as of now, just remember, we have the head, the neck, the thorax, abdomen, which are separated by the dome-shaped structure called as the diaphragm. Below the abdomen, we have the pelvic region, and below it, the lower limb. And these two extended portions of our body, right? That is called as the upper limb. That is called as the upper limb. Yes, Ruhi, KK, Mehak, very good. Nike, very good. Future, Annoyed Atom, Anil, Amreen, Hitesh, Gaurav, very good. Perfect. Perfect, guys. Now, you guys already know that this region, it is called as the back of the body. This is called as the back of the body, right? This is called as the back of the body. This is called as the back of the body. Yes, Vicky, yes, Imamul, very good. This is called as the back of the body. Now, apart from that, guys, this region, can anyone tell me which region is this, guys? Yes, Jura Damani, very good. Can anyone tell me which region is this, guys? The famous region, no? Mind blowing facts, OMG. Yeah, lower limb. Hmm. Hmm. चल बताओ बताओ दिव्या संचिति ठीक है पोस्टीरियर पार्ट है विल कम टू द टर्म्स इंटीरियर पोस्टीरियर सब पढ़ाएंगे सब यस महक डिवाइन सोल वेरी गुड साई चौधरी सलोनी वेरी गुड कनुप्रिया वेरी गुड yes hitesh sambhav naik krishan gaurav usama very good guys that is something that is called as the gluteal region guys this is the gluteal region. Now, I've already told you in one of the exams, right? In one of the exams, no, okay, the NEET PG exam was no getting delayed. So the Indian media has nothing to say about it. So I'm not blaming anything. So that's just a source of no entertainment, guys, that you should know that no all the medicos were circulating one joke. And that time our famous no hero Ranveer Singh has done a photo shoot which went viral on the internet. So the Indian media was more focused on the gluteal region of Ranveer Singh rather than the NEET PG postponement date. So only the medicos can understand what actually the joke was now. So so yes, Amreen David. So that is no actually the advantage of being a medico that some things we only understand and that's not like Most of the people don't. Hmm. Sure. Okay. Now, now, okay. So that was about the regional anatomy. The body is divided into different parts: upper limb, lower limb, thorax, abdomen, pelvic, neck, head, and we are studying these different parts separately. We are studying these different parts separately. Whereas when we come to the systemic anatomy, guys, the systemic anatomy. So you have to remember the entire system. The entire system is studied at once. The entire system, it is studied at once. Now, let me take an example over here, guys, that you already know. We have one system in our body that is called as the cardiovascular system. Cardiovascular system. Now, when I say cardiovascular system, guys, when I say cardio, okay, you guys will tell me what is meant by the term cardio. Okay, chalo, I think that you guys already know this cardio, it is called as the heart, right? Now, when I say vascular, guys, vascular means the blood vessels. Vascular means the blood supply, the blood vessels I'm talking about over here. And the blood vessels are nothing but the arteries and the veins. The arteries and the veins. So, yes, yes, Ravi Raj Singh Tomar, respiratory system can be also one of the system. Now we are studying not only the heart, we are studying along. Okay, we are studying the blood vessels, that is the arteries and veins along with the heart. So heart is not studied alone; it is studied with the arteries, veins, all that is supplying to the heart, the one which is originating from the heart. Okay, the own coronary circulation of the heart. So everything comes in that system only. So in the system, everything, not only the organ, all the associated important vascular vessels, I mean the arteries and the veins, they all are studied over there, right? So so one system, I think divine soul, you're right. Coronary artery, हाँ, ठीक. One system, I think one guy has told me, I've just missed out. Ravi Raj has told respiratory. Can you tell me more system, guys, over here? One system, yes. It has, yes, Ravi Raj has already told. In respiratory system, I want to ask Ravi Raj, what will you study in the respiratory system? What all things you will study in the respiratory system? Only about lungs, or you might have heard about the digestive system, guys, right? The digestive system. Okay. Now, one system that, yes, digestive, Niku, okay, done. Gaurav, done. Divine Soul, Vicky, very good. Future Medico, nervous system. The neuroanatomy wala part jo hai, the nervous system, guys, the nervous system, right? Okay, we have one more system that is called integumentary system. Integ integumentary system. Integumentary system. Can you tell me the meaning of the term integumentary? Can you tell me the meaning of the term integumentary? Yes, साई चौधरी, yes, circulatory वाला ठीक है. एक ने endocrine में लिखा, yes, yes, we have the endocrine system as well. What all organs are the glands? No, you will study over here the endocrine system. Yes, in tegumentary, basically, we are going to study about, yes, you guys are right. We are going to study about the skin and, yes, the skin, dermatology wala part jo hai. Yes, Sai Chaudhary, future medico, yes, glands. Hmm, skin. ठीक है. Yes, guys. Perfect, guys. So I hope you got the basic ideas over here. Yeah, derma wala. Yunus, yes. Mehek, ठीक है. Now, you might have also heard about the urogenital system. The urogenital system. I just want to know, please try to know, type in the chat box, guys, what will we study in the urogenital system? what we will study in the urogenital system. Yes, skin, hair, associated structures, the appendages, the nails, everything, the disorders, right? Disorders, so chalo dermatology mein padhoge, but when we study the system, we have to study the basic core anatomy, the layers of the skin, right? The composition of the different layers, right? Hmm. Hmm. Sure. Meanwhile, you comment. Let's move on to okay, some parts that I have to discuss over here. Yes. चल पहले हम लोग रीजन्स पढ़ेंगे अपर लिम्ब के. यस, फ्यूचर मेडिको एक्सक्रीटरी सिस्टम, यूरिनरी सिस्टम. यस, किडनी, यूरेथ्रा. वेरी गुड हितेश, ग्लोरी, डेविड. यस, महक, संभव, गौरव. फ्यूचर मेडिको यूनस. वेरी गुड, वेरी गुड, वेरी गुड. So right now guys, put the heading. Yes, KK, very good. Mehak, very good. Let us just try to enumerate the different regions of the upper limb. I will be now talking about the different regions of the upper limb, and I will be now focusing on the different regions of the lower limb as well. The lower limb as well. So let us just try to draw a diagram over here. Yeah. Yes. So write down the regions of the upper limb. Regions of the upper limb. Very, very important. अरे अब वो बी लिख लेना क्योंकि वो इट्स जस्ट कमिंग अ लिटिल बिट डाउन. यस. हाँ निकू ठीक है, हितेश ठीक है, इसको फटाफट से एक डायग्राम से बनाते हैं. Again guys, since you are studying anatomy with me, I want everyone to use color pens in your notes. Color pens, the different colors will give you the best remembrance in the exams as well. So from day one, make a habit of writing the notes, drawing the different diagrams that I will be drawing, numerous numbers of diagrams now with you people, and you have to like pen down or draw simultaneously with me. So that it's way important. Yes, Glory David, very good guys. So you guys know already that let us just, I will not be drawing any fancy diagram guys, but I will be drawing the very basic wala diagram, so that yes, it is easier for all the other students to draw. We are not going to draw any fancy diagrams, simple line diagrams in anatomy, just to make you remember. Kanupriya, good. Now let us just try to draw it first. Yes. Now remember guys that this above joint, it is called as the shoulder joint. Shoulder joint. I'm starting from the joint. Just remember, as of now, we have something called as the shoulder joint above. Just you can see my finger over here. We have the shoulder joint over here. Yes. Then over here, yes, we have the elbow joint. The elbow joint. And over here, we have the wrist joint. The wrist joint. Now, from the shoulder joint, guys, you can just see over here in the picture as well that this joint, it is the shoulder joint. Then behind, like we have this elbow joint over here, and over here we have something called as the wrist joint. The wrist joint. So we have three joints, right? From shoulder joint, yes, very important. From shoulder joint to the elbow joint, this region, it is called as the upper arm. It is called as the upper arm, or in Latin, it is called as the brachium. In Latin, it is called as the brachium. Now, when I say brachium, guys, all the muscles, the biceps brachii, brachialis, okay, coracobrachialis, brachii, brachii, basically all the muscles are containing this term brachii in it. So it again defines that these muscles, the biceps brachii, the triceps, you already know we have the biceps and triceps, the two famous muscles that you guys already know that are present in the upper arm region, right? So that is over here you have to learn from elbow joint to the wrist joint. This region it is called as, yes, the forearm, the forearm. And remember this forearm, it is called as the antebrachium, antebrachium. And below the wrist joint, yes, everything, it is the hand. Below the wrist joint, it is the hand. It is the hand. Below the wrist joint, it is the hand. Right? Huh. Now, coming on to the regions of the lower limb, that is you have to know from the shoulder joint to the elbow joint, it is the arm. From the elbow joint to the wrist joint, it is the forearm. And below the wrist joint, it is automatically the hand. It is automatically the hand. Now, yes. ठीक है गौरव सैनी बिलाल अनिल very good guys, very good. Now coming on to the regions of the lower limb. I don't understand, I'll write it here. Yeah, the regions of the lower limb. Just try to draw along with me guys, the regions of the lower limb. The regions of the lower limb. Yes. Now guys, I'm trying to keep it very simple guys, right? I will try to keep it very simple. Yes, Mohammed Bilal, ठीक है. Yunus, ठीक है. Okay, okay, okay. That's manners बोलते हैं in Latin, but it's not required as of, right? ठीक है. So just try to draw along with this. Yes. Just try to draw along with me, right? So that you don't face any problem while drawing, right? Just try to draw along with me, guys. A very simple line diagrams, right? Yes, thigh, leg, and foot. David, very good. Irfan, yes. Okay. Now, guys, see over here, guys. See over here. There is a joint called as the hip joint. I will be discussing everything in anatomy, guys. So please don't worry. The hip joint, it is formed by which two bones or something, whatever comes to your mind, it will be automatically solved when no, the lectures will go in, go with the flow, guys. No, something will come later in the lecture. Okay, you have to wait for that particular time, right? So yes, Kanupriya, ठीक है. Irfan, okay, love you from Pakistan. Thank you so much. Now, regions of the lower limb. This region, it is called as, okay, this joint over here. Let us mark that. This is called as the hip joint. There is something called as the hip joint. Then your favorite joint, guys, the favorite joint where most of your brain resides over here, right? That is the knee joint. Majority of the brains are over here. And please don't take it seriously. I'm just kidding right now. The knee joint, guys, right? The knee joint. This joint, it is called as the ankle joint, guys. This is called as the ankle joint. This is called as the ankle joint. Now, guys, from ठीक है महक David, ठीक है. From the hip joint to the knee joint, guys. This region, it is called as the thigh region. Thigh. खाने वाला thigh नहीं, thigh. Right? Thigh. From the knee joint to the ankle joint, this region, it is called as leg. Be very clear with the terms. Now, when I say leg, guys, it is from knee joint to the ankle joint, right? Below the ankle joint, everything comes under like foot. Now, guys, why these anatomical parts are important? Now, whenever a patient come to you, guys, whenever a patient is coming to you and he's saying that I'm having pain, वो तो अपनी आम भाषा में बोलेगा डॉक्टर साहब मुझे यहाँ पे दर्द हो रहा है, वो छू के बताएगा. आप पेपर में जब लिखते हो ना, कंप्लेंट्स ऑफ पेन इन द राइट थाई, लेफ्ट लेग, complaints of pain in the right forearm, left forearm. When you write these terms now, it is automatically an indication where exactly the pain is there. which anatomical region is involved in that pain. Or so that is why you guys have to be very much clear with this basic terminology, right? The basic regions of the upper limb and the lower limb. So I hope this is clear to each one of you guys. Just give me a thumbs up in the chat box that the regions of the upper limb and the lower limb, it is clear to you, and the different regions. Hmm. Mehek, okay. Ishrat Fayaz, very good. Glory David, Rohi, Krishan, Gaurav, perfect. Yunus, okay. Nike, very good. Very good. Sahil, very good. Sure. Now, guys, two things that I wanted to tell over here, right? That I want to tell over here. Now, very, very important. Now, when we talk about the foot part, this region, this region, it is called as the dorsum of the foot. It is called as the dorsum of the foot. This region, it is called as the dorsum of the foot. The dorsum of the foot. एंड दिस रीजन जिसको हम लोग सोल बोलते हैं, जिसको तलवा बोलते हैं हम लोग हिंदी में, ओके, दिस रीजन इट इज कॉल्ड एज द प्लंटार सरफेस ऑफ द फुट. The plantar surface of the foot. Please be very clear with the terminology, guys. We have the dorsum of the foot. Yes, we have the plantar surface of the foot. Tashrat, nice to see you. Two. Okay, Sabrina, very good. Ha, David, very good. Yes, we have the dorsum of the foot. We have the plantar surface of the foot. Now, guys, again, a very basic important term that I have to discuss over here. Okay, in anatomy, this question that you guys have to write over here, that is something very, very important. In anatomy, right and left is decided with respect to. Okay, now there are only two options that I'm giving you guys over here. With respect to the patient, with respect to the cadaver, or with respect to your own body. Let me simplify it. A patient comes to me, he's sitting in front of me, and he's saying that, Doctor, I'm having pain over here. Now, as you see that, guys, as you see that, so his left will become your right. So, which is correct actually? Yes, Sabrina, very good. It is by respect or with respect to the patient or with respect to the cadaver, with respect to the person next to you. Yes, yes, yes. Now, with respect to the patient, if you understand this, guys, now you guys are going to tell me which thumb is this, right or left? Chal. You guys are going to answer this. Which thumb is this, right or left? Again. हाँ patient ठीक है, divine soul, Ishrat, Krishan, future, very good. You guys are going to tell me, yeah, Hariom, yes, you know, Bilima, very good. Hmm. You guys are going to tell me this is, yes, Kanupriya, it is left बता रहे हैं सब. Okay, Gaurav, nice, Ruhi. हाँ मैं I was just checking this, guys. अभी मैंने बोला कि राइट और लेफ्ट पेशेंट के हिसाब से डिसाइड करते. पेशेंट आके कह रहा है मेरे राइट में दर्द हो रहा है, तो तुम तो लेफ्ट का ऑपरेशन कर दोगे, अगेन न्यूज में हेडलाइंस बन जाएगा ना, डॉक्टर ऑपरेटेड द रॉन्ग पार्ट. तो बेटा यू हैव टू बी वेरी क्लियर विद द फैक्ट कि ये जो है ये राइट थंब है, और राइट थंब इसलिए है क्योंकि हम राइट और लेफ्ट एनाटॉमी में पिक्चर के बेसिस पे, पेशेंट के बेसिस पे, कैडावर के बेसिस पे डिसाइड करते हैं, ठीक है। So I hope this is clear to everyone. Just give me a thumbs up, guys, if you understood the right and left. It is decided with respect to the patient, with respect to the cadaver, okay, which is in front of you. आप अपने हिसाब से मुतुस्वामी, okay, annoyed atom, very good. So I hope it is clear to you guys. Now, before coming to that, yes, you guys are going to mark this as in homework, right? You guys are going to do this as in homework, right? You guys are going to mark all the regions over here, right? You guys are going to mark all the regions. This is your homework, guys, right? And please mark all the regions, right? So meanwhile, just comment, okay, just try to comment that which region is this. Yes, that is I have marked with A. Just write it down in the chat box. Okay. And what is this ninth over here? Which joint actually we are focusing on, this ninth wala part? A and B. Yes, the A and B wala part. हाँ, first वाला तो ठीक है, तो okay, right? Just I'm testing you guys, so just let me know in the chat box. Meanwhile, I'll just turn out to the next topic, that is the normal anatomical position. The normal anatomical position. Yes, the back of the thigh. Posterior part. Dr. Saklan, very good. Thigh. Christian, very good. Posterior region, baby. I'll come to the term posterior baby's creation. Very good. Ishrat, Divine Soul, Yunus, Naik, Medico, Ruhi, Sabrina, Rakhi, Hariom, Gaurav, very good. Ankle joint वाला है, B वाला part. ठीक है, ठीक है. हाँ. Now guys, coming on to the normal anatomical position, the normal anatomical position. Now guys, remember that this normal anatomical position, it is called as the standard anatomical position. It is called as the standard anatomical position. It is called as the standard anatomical position. Now, this standard anatomical position, it is actually the position, okay, it is positional reference, positional reference made for anatomical nomenclature. Now, let me simplify this. Let me simplify this, guys. It is a positional reference made for anatomical nomenclature. Now, guys, everything, whatever we study in anatomy, it is with respect to this position only, which you are watching on the screen, right? This position, it is actually the position in which you study the different parts of the human body. Even if you are working on the cadaver, you have to keep in mind this particular anatomical position, right? Because this is the position that defines the anatomical nomenclature. All the terms, front, back, anterior, posterior, lateral, medial, everything, okay? All the muscles, all the muscle movements, the flexion, extension, everything which comes in anatomy, it is described in this position only. This is the position in which everything is described in anatomy. Okay. Now, what all we can see over here in these position? What all we can see over here in these position? Yes, Harium, annoyed atom. Yes, everyone is right. Everyone is right. Right, right. So now, what all we can see over here? The very first thing in this position, the person has to stand upright. Okay, the person is standing upright, or the person has to stand upright, right? Or the person is standing upright. You can just write like this. It is the person is standing upright, straight. Okay, the person is standing straight, or the person is standing upright. The second one, guys, the second one, the gaze of the person is looking straight, the eyes you can see over here, right? So the person, it is looking straight, it is, yeah, in the normal anatomical position. Yes. Now, you can see over here the third point which is relevant, the upper limb beta. The upper limb. The upper limb beta, it is not touching the sides of the body. The upper limb, it is not touching the sides of the body. You can see it is not touching the sides of the body. It is hanging in the air. It is hanging in the air. ये हवा में झूल रहा है. ये body के side को touch नहीं कर रहा. It is just moving freely in the air. It is just moving freely in the air. Yes, yes. Hmm. So the third point that you guys have to remember over here, that the upper limb, it is hanging. Upper limb is hanging. Upper limb is hanging. And you can very well see that over here we have something called as the palms. These are the palms. And you can see that the palms of this person, they are facing forwards. The palms of this person are facing forwards. Yes, Jura, very good. Yes. So remember, guys, that the palms facing forward, the palms are facing forward, and lower limbs are just parallel to the toes, right? The lower limb, it is parallel, right? They're just side by side, right? So remember that the lower limb, it is parallel to the toes. The lower limb, it is parallel to the toes. The lower limb, it is parallel to the toes. In this position only, guys, in this position only, guys, all the entire anatomical nomenclature is based. All the terms, anterior, posterior, medial, lateral, okay, everything, it is based on this position, with defined with this position only, in this position only. I hope this normal anatomical nomenclature, it is clear to each one of you, and you will never forget it, because we are going to study everything in this particular part only, right? So just give me a thumbs up if this part is also clear. If this part is also clear, just give me a thumbs up in the chat box if the normal anatomical position is clear to you guys. I'm waiting for your thumbs up so that I can move on to the last and the very, very important topic for today. That is the transverse section of the limb. Very, 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 very important. I mean, a lot number of questions have been asked in the NEET PG exam, the FMG exam from this particular topic. So anything which is important, guys, I am always putting a dollar sign in my lectures. Dollar is very important, no? Money, dollar is very, very, very important. So wherever I'm putting a dollar sign in my lectures, please mind it. It is very, very important. Yes, Mehek, Kanupriya, Gaurav, Sahil, Christian, Yunus, Naik, Sabrina, Ruhi, Ishrat, Future Medico, Hariom, Raviraj, Jura, very good, beta. Rakhi, very good. So yes, let us now start with the transverse section of the limb. Now, now guys, let us first understand what is limb. Limb over here can be upper limb and lower limb as well. It can be any limb, right? It can be upper limb or it can be lower limb as well. It can be lower limb as well, right? We have upper limb and we have lower limb as well. Okay, Irfan, very good. So, अरे मेडलाइफ मेरी मर्जी यार, पूरी रात पढ़ाऊंगा मैं, खाली हूं ना, मुझको तो वैसे ही. So we have the upper limb and the lower limb. So I have taken this upper limb wala part, and you guys already know that this is the shoulder joint over here. Behind it is the elbow joint, right? And over here we have the wrist joint. Wrist joint. So now when I say transverse beta, transverse means a cut. I'm cutting this particular region like this. I'm making a cut like this, guys. It is called as the transverse cut. Okay, the transverse cut. And after cutting it, I will see what is inside this. I'm from outside to inside. What are the contents? What actually is the composition? Okay, so this is a transverse cut. Now, can anyone tell me in which region I have made this cut? Which anatomical region over here I have like made a cut over, in which anatomical region, guys? चल बताइए. Now, hmm, which anatomical region? चलो भाई बताओ. Very very important because इसमें अब मैं I'm going to tell you so many things, so many things. The brachium. Okay, very good, Kanupriya. I have like placed a cut on the brachium. Sabrina, yes, it's a transverse cut. Yes, nine brachium, the arm region or the upper arm region. Yes, the arm region or the brachium. Tanmay, very good. It is the arm region. Now, just try to see what. Okay, now what you can see outside, guys. Now you guys can very well see something which is outside, and that is the largest organ of the body. Can you guys comment this structure, which is the largest organ of the body? That is the largest organ of the body. This is called as, yes, the largest organ of the body. सबसे बाहर से शुरू करो बेटा. बाहर क्या दिख रहा है हमको? बाहर क्या दिख रहा है? Yes, very good. Kanupriya, Mohabati, Gaurav, very good. It is the skin, guys. Anil, very good. It is the skin. It is the skin. Yes, it is the skin. Now you already know the skin. It is the largest organ of the body, right? The skin. It is the very very important. You should know that it is the largest organ of the body. Largest organ of the body. The skin. It is the largest organ of the body. Yes, everyone is right. Everyone is right. Right, Osama. Very good. Herion, baby creation, Vedant, midlife, Jura. Very good, very good. The skin, it is the largest organ of the body. Now inside the skin, guys, inside the skin. Now you already know the skin. You will study the skin more in what we say. You will study the skin more in in dermatology, all the layers, the epidermis, okay, the dermis and the hypodermis, okay, the basic layers, right? The basic layers that you will study. Yes, everyone is right. Hariom, Sabrina, Bilal, very good. So you will study the skin in detail in all the parts and also the appendages. When we talk about appendages, I'm talking about the hairs, the nails, the sweat glands, the sebaceous glands, right? So yes, so yeah, so yes. Now under the skin, guys, under the skin, that is something very very important, guys. That is you have to know this yellow colored layer which I am drawing right now. Yes. Can anyone tell me this yellow colored layer? Hmm. Can anyone tell me this yellow colored layer which I'm drawing? And please draw it with the yellow color only. Please follow the color coding, guys. Very 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 important. Hmm. Very good. Epidermis, dermis, subcutaneous, Kanupriya, Gaurav, Ishra, Sabrina, Anil, Divine, very good. Yunus, very good. Yes, yes. It is called as the superficial fascia. Superficial fascia. Now, let me just mark this first, or let me mark it with the black color only. Yes, the superficial fascia. The superficial fascia. The superficial fascia. Now what is meant by the term fascia, guys? Okay, now let us just quickly turn on your page, okay, to the next page, I suppose. Yeah, just write down some terms, guys. That is very, very important. You should know these anatomical terms. What is meant by the term fascia? What is meant by the term fascia? Now, guys, the fascia means, yes, the fascia means it is a membrane like, okay, it is a membrane like sheets, right? Sukhmani, yes, hi. Yes, membrane like sheets. Hmm. Kanupriya, very good. Fascia is basically a membrane like sheets of, okay, membrane like sheets of fibroareolar. Okay, it can be of fibrous tissue also, it can be of areolar tissue also, right? So these are all the connective tissue, guys. These are all the connective tissue. Okay, okay. So it is, the fascia is something that covers the body, that covers the body. So remember, guys, that fascia is just like a membrane. It can be composed of no fibroareolar connective tissue that covers the body, right? Basically, when I say it covers the body, so I'm simply saying that it is present under the skin. Okay, one location it is under the skin. Okay, it also this fascia basically it surrounds muscle. Okay, it also surrounds the muscle, right? Okay, it helps in binding, it helps in binding the tissues and organs together. It helps in binding the tissues and organs together. So yes, guys, it is a membrane like composed of connective tissue, the fibroalveolar connective tissue that is present under the skin. It is surrounding the muscle also. It is helping in the, see, connective का मतलब ही क्या होता है, connect करना, organs को आपस में connect करना या tissues को आपस में connect करना. So this is like the term, the fascia, right? Apart from that, guys, you have to know that this fascia is basically divided into two terms. I mean, two types. So this fascia, it is basically divided into two types, or rather I can say the three types. We have something called as internal fascia also, but majority of the times you should remember we have superficial fascia, superficial fascia, and we have the deep fascia. We have the deep fascia. We have the deep fascia. Now, superficial fascia and the deep fascia, guys. Now, when I say superficial fascia, so it is present under the skin, guys. Superficial means it is more, superficial का मतलब होता है बॉडी के बाहर वाले पार्ट की तरफ ज्यादा, मतलब ठीक है. So it is just present under the skin. Okay, so it lies deep to the skin. Okay, so you have to remember it lies deep to the skin or just under the skin. Okay, it lies just under the skin. Okay, very good, Amreen, very good, very good. You guys are like rocking today. Okay, and it is actually connecting. Now if I just want to show you guys, let us suppose that this is the skin. Okay, and over here you guys will get the superficial fascia, the superficial fascia. Let me just, yeah, the superficial fascia, and below the superficial fascia we have the deep fascia, the deep fascia. So this superficial fascia, it is helping to connect the skin with the deep fascia. So it is acting as a connecting point. Okay. Now, if we just talk about the composition, guys, the composition that is again very, very important over here. The superficial fascia, it is basically composed of, okay, loose areolar loose areolar tissue. Okay, the loose areolar tissue, and also the adipose connective tissue, right? The adipose connective tissue. Adipose connective tissue. Now, when I say adipose, guys, you guys automatically will think of adipocytes. You guys will automatically think of adipocytes. Now, when I say yes, adipocytes are, yes, the fat cells, guys. Very, very important. The fat cells. And these fat cells are nothing but they are yellow in color, right? That's why I have drawn this with the yellow color. So the color coding, it is very, very important in anatomy. Okay. Okay. Now, now the superficial fascia, again, you guys have to know this, that it is thick. Okay. If we talk about the characteristics, guys, okay, if we talk about the characteristics, again, very, very important. The characteristics. This is something that I haven't discussed anywhere. So if we talk about the characteristics, guys, so you should know that this superficial fascia, it is thick, okay, and rich in fat. It is thick and rich in fat in various types. Okay, okay, the superficial fascia, it is rich in okay, fat at one of the sites that is called as the breast, right? Okay, it is also the anterior. I will come to this term anterior. Anterior का मतलब होता है front. Anterior means, guys, front. In anatomy, I will come to the anatomical terms. Anterior basically means front. Okay, anything which is coming in front. For example, our eyes, nose, lips. So they are coming in front. So anterior means front. Anterior abdominal wall. Anterior abdominal wall. I will come abdomen. Abdomen means you can see the below the diaphragm. That region is called abdomen. Okay. So yeah, we have the abdominal wall and the cavity. In cavity, you have various organs, right? So anterior abdominal wall. Apart from that, you will also see this superficial fascia thick in the buttock regions. In the buttock regions. So it is thick in and rich in fat in the breast, the anterior abdominal wall, and the buttock region. Very, very important. I haven't discussed it before. So you have to write these points in your notes, right? Apart from that, guys, you also have to know that this superficial fascia, it is at some places thin and it is devoid of fat. It is devoid of fat. It is devoid of fat. Now, this is devoid of fat in three parts, guys. In three parts, that is, again, you have to remember, that is the scrotum. The scrotum, okay? Okay, there is one more part that is called as the eyelids. Eyelids, and yeah, in males, the penis, right? The penis, right? The scrotum, eyelids, and the penis are the sites where it is very thin and it does not contain much adipocytes. It's like devoid of the adipocytes. Devoid means adipocytes nahi dikhenge. So these three parts, again, you have to be knowing that. And again, one more point, if I have to mention, that it is exceptionally dense in the scalp region. Exceptionally, it is dense in the scalp region. Dense in the scalp region, guys. Very, very important. Exceptionally dense in the scalp region. Okay, the scalp part. Apart from that, the palm of the hand. Yes, the palm of the hand. Now you are very well aware what structure I'm talking about. The palm of the hand, right? And one more important thing that we have just discussed, that is the sole of the foot. That is the sole of the foot. So it is exceptionally dense in the scalp, the palm of the hand. I'm talking about this particular structure, and the sole of the foot, the sole of the foot. So that is about this superficial fascia. And guys, if you want to know the functions, right? Okay, now, okay, you guys are going to tell me, if the superficial fascia, it is rich in fat, it is rich in adipocyte, what is the function of the superficial fascia? And I'm waiting for your answers, guys. If this is rich in fat, what function it will perform? Hmm. I'm waiting. Yes, Vicky, very good. Hmm. Hmm. Huh. Chalo, let's try to answer this. Yes, yes, protection. हाँ ठीक है नहीं protective function है, but how it acts as in, okay, if we just want to know the functions of superficial fascia, the the functions of superficial fascia. Yes, protection to produce energy. Okay, cold and pressure. Very good, Razavi. Very good, Vicky. Okay, now guys, being rich in fat, guys, remember it acts as an insulator, guys. It acts as an insulator. Okay, it acts as an insulator for conservation of body temperature, right? And it acts as an insulator for conservation of body temperature. Yes, protection, maintain posture, very good. For conservation of body temperature. For conservation of body temperature, right? Now, it gives the surface बिल्कुल ठीक बोला है protection, posture, yeah, it gives a rounded contour to the body, right? Okay, now you already know that it will fill up the various spaces, the hollows, okay, and all the irregularities of the body, okay, so that is why it is giving the body a rounded contour, okay. It also facilitates the movement of the skin, okay, it also facilitates the movement of the skin and the underlying structures as well, right? And most importantly, it is acting as a reservoir for fat. It is acting as a reservoir for fat. It is acting as a reservoir for fat. Hmm. Hmm. Okay, so I hope it is clear to everyone. Yes, I hope the superficial fascia it is clear to everyone. Just give me a thumbs up in the chat box. Yes, just give me a thumbs up in the chat box if the superficial fascia is done. Now, now, as soon as you remove the skin, you dissect the superficial fascia, you remove the superficial fascia, the another layer which comes into picture, it is called as the deep fascia. The another layer which comes into picture, let me draw it with blue color so that it's like, yes. Yes, Kanupriya, Rasavi, Krishan, Naik, very good. What about rest, guys? I hope you all are understanding you are all listening to my lecture with full concentration. You are writing the notes along with me. Hari Om, Kanupriya. Yes, Vicky Chaudhary, very good. Hmm. Harry on, Zohra, very good. Okay. I'm like expecting everyone writing the notes along with me. Chal. Now coming on to the next structure over here, guys, that is the deep fascia. Yes, this is the deep fascia, guys. That is like you have to, hmm, that is underlying this particular fascia. That is the deep fascia over here, right? This is the deep fascia. So just write it down over here. That is the deep fascia. Deep fascia. Deep fascia. Very good, Gaurav. Very good. Now, when I say deep fascia, guys, let us understand something about the deep fascia now. So now, when I say deep fascia, deep fascia, deep fascia. Now, guys, remember that the deep fascia, it is non-elastic. Very, very important. It is non-elastic. it is tough. Okay, now when I say tough, it is very, very hard, guys. Non-elastic. What is happening? It is, okay, let me write it down, otherwise it will again. Non-elastic, tough. Okay, non-elastic, tough. Now, tough, it is basically because of a tissue that is called as the fibrous tissue. That is called as the fibrous tissue. It is non-elastic, tough, fibrous tissue. Yes, yes, you are right, Mohabbati. Very good, Kanupriya. Very good. Yes, it is rich in collagenous fibers. It is rich in collagenous fibers. Now, when I say collagen, collagen basically beta is a protein, right? And it is giving that tough strength. So yes, the deep fascia, it is non-elastic, it is tough fibrous tissue rich in the collagenous fiber, right? So yes, so yes, I will be, yes. Now, if we just simply talk about the sides, guys, if we talk about the sides, it is enclosing the muscles, guys. Yes, Gaurav, very good. Vicky, very good. Remember, it envelops the muscles, right? So all the muscles, it envelops the muscles, right? जैसे चिट्ठी लिखते हो, ठीक है, और चिट्ठी को एनवेलप में डालते हो, इसी तरीके से मसल्स जो होते हैं, दे आर बेसिकली कवर्ड विद दिस डीप फेशिया, राइट? And it envelops the muscles. Basically, it forms the sheath and it surrounds them. Okay, around them. And also it encloses the neurovascular bundle. Very, very important. It encloses the neurovascular bundle. Now, when I say neurovascular bundle, guys, when I say neurovascular, neuro basically means the neuron or the nerve, right? And vascular basically means the vessels, the blood vessels, the arteries and the veins. So veins, arteries and nerves, they are enclosed by the deep fascia to provide protection. Again, it has a very important role, no, of protection. If it is very tough, guys, only then it will be able to perform the function of protection, right? Now, yes. Apart from that, yes. Now, can anyone tell me what is the function? Okay, what is the function of the deep fascia? Hmm. वो ठीक है what is the function in the deep fascia, guys? Now, guys, one important function that I want to discuss, that is the circulatory function, guys, of the deep fascia. It has many, many functions, but one important function, it is the circulatory function. I will just explain this. I will not make you write thesis. So just you already know, beta, in the lower limb wala part or in the lower parts of the body, the muscles are basically enclosed by this deep fascia. So as soon as the muscle contracts, the deep fascia also, okay, it promotes the circulation in the deep veins. Okay, it is actually helping in the contraction of these deep veins so that the blood can be returned to the heart. You already know the veins basically take the blood to the heart. Now, against the gravity, the blood has to go up. So it needs a support system, and that is again by the deep fascia, right? So yes, हाँ हाँ ठीक है, सर्कुलेटरी वाला पार्ट भी ठीक है, right? Now, again, it forms the sheath around various parts like femoral sheath, carotid sheath. So that is something you can remember. Okay. Hmm. Even guys, even it is thickened around the joints. This deep fascia, it is thick around the joints. It is thickened around the joints of the body. The joints of the body. Now, when I say it is thickened around the joints, you guys should know that I am talking about, yes, साहिल ठीक है वो, हाँ, hmm. It is thickened around the joints. For example, the wrist joint, the ankle joint. Okay, it actually forms the transverse bands, right? Transverse bands. So the various joints, the wrist joint, the ankle joint, it is thickened around them to form the bands. That is called as the retinaculum, guys. That is called as the retinaculum, right? Okay. So that is something that we have to know about this. Okay. So yeah, that is about the deep fascia, guys, right? Okay, the two important thing that I have to highlight over here, this deep fascia, it is absent. Yes, Gaurav, very good, guys. This deep fascia, it is absent. Let me just write it over here so that you don't remember. I mean, so that you don't forget. This deep fascia, it is absent in. Remember the face part and the anterior abdomen, or simply write down abdomen. Abdomen. Now, guys, again, there is a reason over here. Yes, Sabrina, Gaurav, Raviraj, very good. Again, there is a reason, guys, why it is absent in face. Now, guys, imagine if the deep fascia is present in the face region. It is made up of collagen, right? Very tough fibrous tissue is there. Would you be able to move the muscles? I mean, the muscles won't. You won't be able to show your expressions. You won't be able to eat something. You won't be able to chew. It will make your face hard like robot. Chitty. Chitty का भी face move कर रहा था. In that case, you guys have to remember that face is a place where the deep fascia is absolutely absent, except for some reasons I will tell you when I will discuss the anatomy of the face, right? And in the abdomen also. Now, why the deep fascia it is, yes, why the deep fascia it is absent in the abdomen, guys? Can anyone tell me why the deep fascia it is absent in the abdomen? Because if you're eating the food goes into the stomach or the intestine. The intestine stomach needs to expand. Okay, expansion of the organs requires space. If there is a deep fascia, guys, there will be no expansion of this the internal organs, the visceral organs, and again collapse, boom, bam. तो अगर डीप फेशिया होता तो एवरीवन वुड हैव सिक्स पैक, नो सबकी बॉडी एकदम फिट होती, ओबेसिटी होती ही नहीं बिल्कुल किसी को. ओबेसिटी हो ही इसलिए नहीं बिकॉज द डीप फेशिया इज नॉट देयर, and it is just because the abdominal organs need to expand. Expansion of the organs, the visceral organs, right? So yes. So that is something that you guys have to take away from here. Apart from that, now in the middle, guys, you already know which bone we have in the brachium region. You guys are going to tell me the name of the bone that is present in the brachium region. Yes. हाँ, you guys are going to tell me the name. 8 पैक पॉसिबल नहीं, वो तो मैंने बताया था ना क्लास में. हम्म. बताओ बताओ कौन सी बोन है यहाँ पे. Now there is a bone that is present in the arm region. We have already discussed this. Sorry, net channel. That is the humerus. Very good, guys. Very good. Osama, Naik, Amreen, Krishan, Faisal, Jura, Sahil, Vicky, Raviraj. Very good, very good. We have the humerus bone in in the middle of the arm region, right? Raviraj, very good. Apart from that, you guys already know that this bone, okay, it is like let me just draw in such a way that you guys remember over here that it is covered, it is surrounded by the muscles. It is surrounded by the muscles, and these muscles are nothing but the skeletal muscles, right? These muscles are nothing but the skeletal muscles. skeletal muscles. Now, skeletal muscles are those muscles which help in the attachment of the bone. Okay, the muscles which are attached to the bone, they are, देखो नाम ही लिखा ना skeleton. It is attached, the muscles which are attached to the skeleton, the skeletal muscles, the skeletal muscles, right? The skeletal muscles, right? Now, apart from that, guys, you have to know the 5 layers now. We have the skin, the superficial fascia, the deep fascia, the skeletal muscles, and the bone. From outside to inside, the major 5 points that you have to remember. Yes, we have the skin, the superficial fascia, the deep fascia, the skeletal muscles, and the fifth one, it is the bone. The fifth one, it is the bone. Now, guys, over here, just try to remember one thing, that in between the muscle, there is a space that is present. In between the muscle, guys, I'm just trying to highlight this particular area right now. This area, guys, which I'm highlighting right now, this space is there. Now, this space, it is called as, or let me write it like this. This is called as the intermuscular space. Intermuscular space. Intermuscular space. Intermuscular space. Yes, very good, guys. Very good. The intermuscular space. Now, guys, what is meant by the term inter, guys? Now let us suppose that this is cell 1 and this is cell 2. This is cell 2. Whenever I'm talking about the space in between the cells, it is called intercellular. Intercellular. Intercellular simply means in between the cells. Intercellular. Okay? Intercellular. Yes, Tanmay, very good. Yes. Yes, Tanmay, very good. Intercellular. Huh. Now, Now, if I am talking about only one cell and I'm talking about the space present in that cell, that is called as intracellular. That is called as intracellular. So this space I'm talking about in between the muscles, in between the muscles. That is why it is called as the intermuscular space. Now this intermuscular space, this space basically carries 3 things better. That is the veins, the arteries, the veins, the arteries, and the nerves. The veins, arteries, and the nerves. So, yes, the content of this intermuscular space, very, very important. The content, yes, very good. Mansoori Imtiaz, yes, very good. Amreen, very good. Kanupriya, very good. The content, guys, over here that you have to like remember. The content, it is the neurovascular bundle. The neurovascular bundle. The neurovascular bundle, it is VAN, vein, artery, and nerve. Vein, artery, and nerve. Right? Content means what is present inside the space. What is running inside the space? It is nothing but the vein, arteries, and the nerves. The vein, arteries, and the nerves. Right, Gaurav. Very good, guys. Very good. The veins, arteries, and the nerves. Now, apart from that, guys, you also have to remember one more important thing, that this intermuscular space, it is surrounded by, okay, it is actually like a space, a hollow space, okay, and you already know that any space will have its boundaries. For example, if we are talking about the simple your room, right? The hostel room where you are sitting, right? You are surrounded by the walls. So basically, okay, we have the walls, we have the roof, and we have the floor. Similarly, this intermuscular space, remember, the intermuscular space will also have the roof, the floor, and the contents. And the contents. Yes. Beta veins are more superficial as compared to the arteries, Kanupriya. And arteries are deep seated. Right, beta? Very good. Now, content you already know, guys. Content basically means whatever is inside. Like you are sitting inside the room. You are itself a content of the room. Okay, what is inside the room? What is inside the space? It is the neurovascular bundle. The neurovascular bundle that you already have, like you understood, I suppose, the vein, arteries, and the nerves, right? Apart from that, guys, you have to remember the roof. See, the roof, the own roof of your room, छत जिसको बोलते हैं, छत का काम क्या होता है? प्रोटेक्शन देने का. इसकी जो छत है बेटा, इसकी जो छत है, this is actually the छत. This is the roof वाला part. I'm not getting exact. हाँ, चलो मैं वॉयलेट से ही कर देता हूँ. ये पूरा का पूरा क्या है? That is the roof, guys. Roof. Roof is basically composed of, yes, the deep fascia, the superficial fascia, and the skin. The superficial fascia and the skin. Yes, and the skin. The deep fascia, the superficial fascia, and the skin. That is again you guys have to remember. Okay, the roof over here, obviously बेटा खुद देखो ना, बाहर वाली चीज ही क्या है? Skin. Skin is giving protection to the underlying arteries, nerves, and veins, right? Everything inside it. So the skin वो रूफ में ही आएगा ना, जो जिसका काम ही प्रोटेक्शन का है, right? Right? Yes. The floor, guys, the innermost structures over here, you guys can see it is composed of the muscles and the bones, right? It is composed of the muscles and the bones. The floor wala part, the muscles and the bones. The floor, it is basically composed of the muscles and bones, right? The innermost structures, the muscles and the bones, right? Yes, yes. Yes, everyone is right. Everyone is right. Now, apart from that, guys, you guys also have to remember that the intermuscular space, it is divided into two parts. Okay, the one which comes in front, it is called as the anterior part, the anterior compartment, and the one which is behind, it is called as the posterior compartment. It is called as the posterior compartment. एंटीरियर का मतलब क्या होता है बेटा? द वन विच कम्स इन फ्रंट. देखो, एक आगे वाला हिस्सा होगा और एक पीछे वाला हिस्सा होगा. एनीथिंग विच इज कमिंग इन फ्रंट, इट इज कॉल्ड एंटीरियर, and the one which is behind or towards the back, right, it is called posterior. This space, it is divided into anterior and posterior compartments with the help of this septum. Okay, and that is called as the intermuscular septum. It is called as the intermuscular septum. Now, when I say intermuscular septum, guys, when I say, yes, Sahil, very good. When I say intermuscular septum, it is nothing but the modification of deep fascia. It is nothing but the modification of deep fascia only. I've just told about one of the functions over here. It is dividing the space into two compartments, and each compartment will have its own neurovascular bundle, the van component, right? The van component. Each component has its own van component, right? the veins, arteries, and nerves. The veins, arteries, and nerves. Right? So yes, intermuscular septum. So every compartment, the interior, एक आगे वाला हिस्सा हो गया और एक पीछे वाला हिस्सा हो गया. So automatically each compartment will have its own vein, artery, and nerve, right? So I hope this is clear. Just give me a thumbs up, guys, if this particular section is clear to each one of you. Just give me a thumbs up in the chat box if this is clear to each one of you, guys. Please let me know if this is clear to each one of you. Then I will discuss some important questions that have been asked in the exams, right? Just give me a thumbs up. I'm waiting for your thumbs up, guys. Sure. Okay, Sahil, very good. Faisal, Amreen, very good. Very good. Dr. Harshit, Sabrina, Tanmay, Kanupriya, Nike, Krishan. Okay, Anil, Vedant. Very good, guys. It takes no courage to know listening me out at 11:40. It's the time in India right now, and you guys are listening me. Hats off to your energy and patience level. So, Harry on, Amreen, Atul. Perfect, guys. You guys are like rock stars. So let us discuss some important things over here. Yeah, I just want to mention some important things. Okay, the two important things that you guys have to remember. Yeah, these are all the important questions that have been asked. All the yes, Vicky, Juhra, Hariom, yes, all the neurovascular bundle of our body, all the neurovascular bundle of our body have same sequence. Okay, exception you have to remember, except all our body will have the same sequence, the vein, artery, and nerve, right? But except the two important things that have been asked in the exams, right? The first one, that is the first intercostal space. That is the first intercostal space. Please try to be with the flow, guys. Please try to be with the flow. Yes, Sabrina, very good. Bilal, okay. Try to be with the flow. The first intercostal space. Now, when I say first intercostal space, you guys already know that let us suppose this is the sternum, right? Let us suppose this is the sternum. And yes, from the sternum, you guys already know we have the two, yes, ribs. The first rib and the second rib. Now, when I say first intercostal space, it is actually the space in between these two ribs. Inter का मतलब क्या होता है बेटा? Inter means in between the two. Inter means in between the two, right? So that is the intercostal space, right? Intercostal space. The first intercostal space. It has the order of NAV. It has opposite order, nerve, artery, and vein. Nerve, artery, and vein. And again, one more important point that we have to mention over here, that is the popliteal fossa. Popliteal fossa. The popliteal fossa. Now, when I say popliteal fossa, now what is meant by the term fossa? Now, remember guys, this intermuscular space can present as the triangles in our body, or it can also present as fossas in our body. We have different fossas in our body: cubital fossa, popliteal fossa. Okay, the different triangles, femoral triangle, neck triangles. This space can be fossa का मतलब ही क्या होता है? Space. Fossa is the face वाला part. ठीक है? Huh. Sabrina, Kanupriya, yes. So you guys have to remember कि this fossa, this popliteal fossa. Okay, if I ask you guys are going to tell me this popliteal fossa, it is present, yes, behind which joint? This popliteal fossa, it is present behind which joint, guys? Can anyone tell me over here? This popliteal fossa, it is present behind which joint? Hmm. Yes. Anyone? Yes, it is present behind the knee joint. That is the popliteal fossa. Okay, it is present behind the knee joint. Kanupriya, Osama, Sahil, very good. Vicky Chaudhary, Anil, very good, guys. Amreen, very good. Sahil, very good. It is present behind the knee joint, guys. It is present behind the knee joint. This popliteal fossa, it is present behind the knee joint. Again, this will have the same order, right? Okay. Apart from that, two more questions that I have to discuss. The neurovascular bundle. The neurovascular bundle. It is absent in. It is absent in, very, very important. You guys have to know. It is absent in the superficial posterior compartment of the leg. Superficial posterior compartment of leg. Now, when I say leg, guys, firstly understand the terms. When I say leg, you guys already know. When I say leg, leg is from the knee joint to the ankle joint. From the knee joint to the ankle joint. Now, posterior means the posterior part of the leg. I'm just talking about this wala part, right? This is the knee joint, ankle joint, or ye wala part jo hai, that is the posterior part of the leg, right? The posterior part of the leg. And in the superficial part, just in the superficial part, it is devoid of the neurovascular bundle. It is devoid of the neurovascular bundle. Apart from that, one more question that has been asked in the AIMS exam that you guys have to remember, that the neurovascular bundle in abdomen. I will teach abdomen. I have already taught abdomen on the YouTube. In abdomen runs in between two muscle layers. Two muscle layers. Very, very important. And these two muscle layers are nothing but, yes, the internal abdominal oblique muscle, internal abdominal oblique muscle, and one more that is called as the transverse abdominis muscle. Transverse abdominis muscle. Again, guys, you have to be very clear with the fact that obviously the neurovascular bundle, the nerves, veins, and the artery will run in between the two layers only. Okay. Yes, Kanupriya, right. It will run in between the two layers of the muscles only. These are all questions that have been asked in the exams, right? These are all previous year questions that have been asked in the exams. Very, very, very important, guys. Very, very, very important. Okay. Hmm. Yes, Tanis, yes, very good, very good. Now. So over here, I also want to discuss one important concept that, yes, one law I have not discussed over here. That is called as the Hilton's law. There was a scientist called as Hilton. So he has given a law, and just try to understand this, that the supplying the muscle, nerve supplying the muscle also, nerve supplying the muscle also innervates Okay, it will go inside, also innervates the skin, overlying the muscle, right? The skin overlying the muscle and the joint on which the muscle acts, on which the muscle acts. So, nerves supplying the muscle. Now, you already know, for example, we have one very common muscle. Let us take the example no, of any muscle in the body, right? Whether it is biceps, whether it is triceps, right? So any muscle, it is supplied by the nerve, right? So the nerve which is supplying the muscle, it will also supply the skin which is present on the top of that muscle and also on the joint on which that muscle acts, right? So the skin, the muscle, the joint, everything which is in relation to that particular muscle will be supplied by the same nerve, guys. Will be supplied by the same nerve. So that is something that you have to take away from over here. So all the important points, all the diagram, the deep fascia definition, functions, the fascia, right? All the important concepts. So yeah, now before that, please try to answer this particular clinical question. And I want every one of you to answer this question. Before we end the session, please try to answer this question. An X-ray of 65-year-old man is being performed. While performing the X-ray, the radiology technician asks the patient to stand in an upright position. Okay, upright position with his arms abducted. Abducted means the arms are going away from the body. Abduction का मतलब होता है, I will teach this term tomorrow as well. I will teach this term tomorrow as well. Now whenever I'll teach the muscular movements, so you have to know when I say abduction. Abduction basically means taking the part of the body, I mean taking the part of the limb away from the body. Okay, the palms and the head in a forward direction. Which of the following describes the position, guys? Which of the following describes the position? Yes, Kanupriya, very good. It is the anatomical position. Osama, very good. It is the anatomical position. Very, very, very good. Posterior anterior is nothing. Posterior decubitus, we'll learn it tomorrow. Anterior posterior, we'll learn all the anatomical terms tomorrow. Yes, we'll learn all the anatomical terms tomorrow, right? So yes, it is the anatomical position. See, questions are nowadays more clinical, but this is like a very easy question, I would say, just to get in touch with what all we are going to do in the future classes. I am going to cover everything, the entire general anatomy within 1 week. The whole schedule is posted on my Telegram group. Okay, what I'm going to do. So today we have already discussed the definition, the concept of anatomy, the regional anatomy, the systemic anatomy, the various regions of the body, right? And we have already discussed the regions of upper and lower limb. We have discussed the normal anatomical position, the transverse section of the limb with the applied aspects, the fascias, superficial fascia, deep fascia. We have Hilton's law, all the important questions, PYQs that have been asked in the exam, right? And along with the clinical question. Now, guys, you are, if you want, you can just connect to me on my Instagram, right? The easiest possibility is to connect me. Arms. See, I'm talking about the combined upper limb. It is not touching the sides of the body, right? So that is yes, the part of the arm is also, yeah. See, some part it is not touching the side of the body, it's a little bit abducted, right? So that is something you have to know. You can just connect to me on my Instagram, guys, for any doubts. The best, easiest way nowadays. So that is my Instagram handle. So yes, it is Abhijit Kumar 7859. Abhijit Kumar 7859. You guys can connect me on my Instagram handle for further doubts. So tomorrow the class will be there. I will let you know the timings. Yeah, and everything will be posted on the Telegram group mentioned below, right? Sure. It will be posted on the Telegram group as mentioned, right? I hope you all understood today's lecture. I hope you all understood. We have discussed important concepts today, right? So, yes, I hope you all understood what we have discussed today. So, Chal, goodbye. Take care. Good night. It's time to sleep now, right? So, thank you for your patience. Thank you for listening me out, right? Chal. Okay, guys. Bye.